I've provided a handout, another, 30, 40 articles, kind of troubling, all about related to mRNA, genetic therapy, also known as vaccines. There are a lot of calls to halt all distribution and use of the vaccines, and now there's calls for prosecution of those who developed and promoted the vaccines under Geneva Convention, crimes against humanity type thing, because it's becoming more and more apparent that these were designed as a population reduction tool. The death toll's enormous. If you look at the data, CDC doesn't really publish the data, they're hiding it, but if you go to the insurance industry, you can see that excess deaths are up and have been up since they started issuing the vaccines at a level that is what's being called 12 sigma. If you know what, 3 sigma, 6 sigma, 12 sigma would be, like 1 in 100 billion chance it's random, that this was by design. The government and the CDC suppressed the data, the insurance company executives, and there's some, CEOs of insurance companies in here that are calling this out. And then to give you an idea how bad it is in the suppression, the CDC responded to a Freedom of Information request for a 150-page report, and they redacted every single word in the report. Now, I have to assume they're hiding, that they're guilty or there's something going on there. You don't just redact everything. That's got to be a record. And they're not doing anything to investigate this, and they don't want to know what the thing is. So don't believe anything you hear from the FDA, CDC, NIH, president, or anybody in the federal government, in the administration. It's, based on all the comments from the World Economic Forum and guys like that, there's a population reduction agenda in play here. The mainstream media are beholden to pharmaceutical advertising. They will not bring this up. They will not cover it. So you have to go to alternative media to find this stuff. And you can look through the articles. I think you'll find them interesting. Thank you very much.
Okay, thank you. We'll incorporate this in the record. Thank you for your comments. Has the agenda been posted in compliance with NRS?
Yes, Amber Edwards, for the record, verifies that the agenda for this meeting was posted on the 8th day of March 2024 between the hours of 1 and 5 p.m. at all the locations listed on the agenda.
Okay, thank you. Item 6 on the agenda is consideration and possible approval of the minutes of February 8th, 2024. Are there any corrections or additions to those minutes? If not, I'll entertain a motion to approve those.
Larry Rackley, for the record, I'll make a motion to approve the minutes of February 8th, 2024.
Do we have a second?
Denise Ferguson, for the record, I'll second.
We have a motion and a second. All in favor?
Aye.
Aye.
Opposed? Motion carries, and the minutes have been approved. We'll go to item 7A, consideration and possible action, motion for notice of a subaward between the State of Nevada Department of Health and Human Services and Central Nevada Health District in the amount of $333,333 from 7/1/23 through 6/30/24 to engage the community and partners to identify the public health service gaps, increase partnerships, and ensure quality services for frontier and homebound populations. Darren?
Mr. Chairman, members of the board, thank you.
This particular funding opportunity is one we've been talking about for several months now. This is a funding opportunity through the Fund for a Healthy Nevada. They found a pot of money of $1 million. They split between the 3 health districts. And so each health district ended up with the $333,333, and which was great for the state to find that funding opportunity, but more importantly, they allowed a lot of flexibility with this particular grant. And so we were able to build in some infrastructure that we needed. You may see in there, one of the big ones is, buy a couple vehicles for us. That was big, right? We don't have the transportation that we need to get everybody around, so that was big. Really looking at trying to look community gaps, just trying to engage the community, so they allowed us a lot of flexibility in building this particular grant. So, yeah, with that, I'll turn it back to you.
Are there any questions of Darren on this agenda item? From the board or from the public?
Darren, is this a renewable grant or an opportunity for a renewable on this grant, or is it a one-time thing?
Mr. Chairman, members of the board, for the record, Darren Winkleman. Yes, and I say that reluctantly, just, we have been told that this will carry another $333,000 into the next fiscal year. Past that, we're not sure. So we'll get 2 rounds from our understanding, and then we'll have to kind of negotiate from there. But then there's a lot of effort right now in place to try to get with the legislature this next go around to help bolster some of this funding that maybe play a part in that.
Okay, any other questions? Being none, I'll entertain a motion.
Mr. Chairman, Bob Erickson for the record. I would move that we approve the subaward between the State of Nevada Department of Health and Human Services and the Central Nevada Health District in the amount of $333 from July 1st, 23 to June 30th, 24 to engage in the community and partners to identify public health service gaps, increase partnerships, and ensure quality services for frontier and homebound populations.
Do we have a second?
This is Denise Ferguson for the record. I'll second.
We have a motion, a second. All in favor?
Aye.
Opposed? None opposed, the motion carries. And you're free to pursue with that grant, Darren, thank you. Item 7B, consideration and possible action concerning approval of a contract with David Evans, RN, MSN, to provide professional health services in the district for services related to testing, vaccine, and community engagement and phlebotomy services in the amount of $200 per day as scheduled. Darren.
Mr. Chairman, members of the board, for the record, Darren Winkleman. This is a contract twofold in this particular one. Dave has been in contract with the district since the beginning. His particular contract had a couple dates in there that were askew, and so we wanted to bring and make sure those dates were corrected. And then we added in this particular motion the duties of being a phlebotomist. We're finding more and more some of the draws that we do are difficult, and so to have that tool in front of us and be able to have a trained phlebotomist be able to come in and help us was significant for us. And so that was the addition to this particular contract, again, just to clean it up and then to add phlebotomy services. We're required under one of our grants to provide blood draws for the TB patients, and so this will be helpful in that endeavor. So, Mr. Chairman, I'll turn it back to you.
Is that just for this fiscal year or after?
Ongoing contracts, yeah. I believe contracts renewed after a certain point in time, automatically renewed.
Any other questions from the board or the public? I'll entertain a motion then.
Larry Rackley, for the record, I'll make a motion to approve a contract with David Evans, RN, MSN, to provide professional health services to the district for services related to testing, vaccine, and community engagement, and phlebotomy services in the amount of $200 per day as scheduled.
Is there a second?
Mr. Chairman, Bob Erickson for the record, I'll second.
All in favor?
Aye.
Aye.
Opposed? None opposed, the motion carries, and we'll move to item 7C. Consideration and possible action concerning approval of a contract with Janelle Wood to provide professional health services in the district for services related to phlebotomy services in the amount of $175 per day as scheduled. Darren?
Mr. Chairman, members of the board, for the record, Darren Winkleman. This is a similar contract that we just had previously. The one we had previously, Dave will help us in some of our outlining areas if needed, and here as well in the city of Fallon and Churchill County. The one for Ms. Wood would be helping us on our the draws that we do for the TB patients that we come in every Tuesday. So she would be coming in on a more regular basis to help us with that particular endeavor. But again, contracts are just pretty much the same, dollar amounts a little bit different. Dave does a lot of some of the other community outreach for us in other vaccine vaccine injections for us as well. So this one's just a little bit less because she's only strictly for phlebotomy.
Okay, any questions for Darren from the board or the public? If not, I'd entertain a motion.
For the record, Larry Rackley, I'll make a motion to approval of a contract for Janelle Wood to provide professional health services in the district for services related to phlebotomy services in the amount of $175 per day as scheduled.
Do we have a second?
This is Tyson McBride for the record. I second.
We have a motion, a second. All in favor?
Aye.
Aye.
Opposed? Being none opposed, the motion carries. We'll go to item 7D. Consideration and possible action concerning a motion to provide the fiscal year 2025 annual base rate, the annual per person capita fee, and the annual contingency rate as follows. The annual base rate for each county equals $100,000. The per capita rate, the per person capita rate for the city of Fallon's $46,540. Churchill County's $86,280. Pershing County's $28,320. Mineral County's $24,350. Eureka County's $9,235. The annual contingency fee is the city of Fallon's $15,210.63. The Churchill County's $28,462.66. Pershing County's $7,702.35. Mineral County's $7,351.73. Eureka County's $3,261.63. After questions or discussions from the board, I'm just going to ask for a motion to approve those rates by the board without them having to repeat that motion. Is there any questions from the board and or the public? Darren, do you want to explain it?
Mr.
You
Chairman.
can explain those times as by $5.
Mr. Chairman, members of the board, for the record, Darren Winkleman. As you know, the funding responsibility for the district is allocated amongst the district members. The amount owed shall be calculated, determined, and approved by the board, which includes that annual base rate, the per capita rate, and the annual contingency fee. The annual contingency fee is collected up until we reach the amount of $200,000. Once we reach that, then that goes away until such time if we dip into that $200,000 for whatever reason, then that contingency fee would kick back in. So after this particular, after FY25, the contingency will go away. But the annual base rate and the per capita rate, though, will continue each fiscal year.
And these populations, if you might explain where they came from?
Yeah, so the populations came from the governor-approved demographer's office, state demographer, 2022 numbers. We had a little bit of difficulty locating last year's numbers and how those were calculated, and so we felt this was the best way to go about it. I have spoke with each of the counties, and everybody agrees that those are the numbers they're using for other things they need to calculate as well. So I think you had that, either the link or where we arrived at those numbers in your packet.
Are there any questions on this agenda item from the board or the public? If not, I'd entertain just the motion as I read the agenda item, so you don't really have to repeat it all. So I think if someone just moved.
For the record, Larry Rackley, I make a motion to approve as described.
We have a motion to approve this agenda item as read by the chairman. Do we have a second?
Mr. Chairman, Bob Erickson for the record. I second the motion.
We have a motion and a second. All in favor?
Aye.
Aye.
Opposed? Being none opposed, the motion carries, and we'll go to item 8, which is board reports. Is there anything from the board today that they would like to report on? Or if they have a future agenda item that they'd like on the agenda, is there anything today? Okay, we'll move to 9A then. Staff reports, the health officer report. Dr. McDonald. Still off there. There you go.
Good afternoon, Board and Mr. Chairman. Thank you for the opportunity to present Dr. Ted McDonald for the record. In my packet, I've provided you the summary of everything, and also I know that the reporting from the different departments appears to be a little bit longer than normal. And there's a reason behind my madness is as we start continuing with this process, we may find that you might want to move to meetings every 2 months or 3 months. And I wanted to give you an idea of what it looks like to have, at least for the epidemiology, what kind of a 3-month report looks like. Also, a lot has been happening over the last 3 months, and I wanted to give our department heads a chance to provide the overview of what's happened in the last 3 months. So I apologize for the little extra stuff in there, but as we continue with 1-month meetings, we'll go back to 1-month presentations with the changes. But if we move in any different direction, we're ready to go with that. The other thing along the way is we are now taking over the epidemiology. We finally got a report from the state saying that we are now officially in charge of investigating and reporting, being reported to about epidemiology. With that, the staff is prepared to go. We still have support of the state on any areas where we may be looking for further information, but we're moving ahead. We're now recognized basically by the state that we're doing this. With that, there's what I would see in the future is asking the board, sometimes if you wish to have certain things that are monitored on a regular basis. We're in a respiratory season now. It's important to know what's going on in the county with the most prominent things. But on May 1st, the CDC is probably not going to require hospital reporting on COVID virus. And also a lot of the things have come off the urgency about it. It's becoming a respiratory virus. And that's what they're going to look at it unless something changed. Which doesn't mean that things aren't more serious. We should still do all the preventative things, and I've got listed in there all the little steps. But this is something where we're moving that direction. And if there are other things, though, in the community that the board is interested in or that our partners are interested in, we can report that to them. So for future, if you have ideas or you're in touch with organizations that wish to have more reporting, we can provide that. We will be providing to our constituency, the hospitals and the clinics that we report to, we will be providing them that information as they want it. So if they want demographics about their county, we will be able to provide them that at request, and we'll do so. Our epidemiologist, Victoria Spesic, has met with a lot of these organizations. We'll be re-meeting with Banner Hospital at the end of this month to set up the channels to get things working. But that's pretty much in place. Our environmental specialists have already started going out and looking at restaurants and water situations. So they're, part of what I say in my note is this has been an exciting time this last 3 months because things are rolling, they're moving, and the most important part of this whole process is having a staff that is on board for the mission. And I can tell you for a fact they're on board for the mission. And I'm just happy to be kind of on this, being an advisor along the way. Interesting also coming up is there's a lot of discussion about doing state health assessments. NACO is coming out with a assessment that they've approached other counties with, where they will be doing an assessment and providing that information to the counties. In our meetings in Pershing County, when we've talked with the CEO there, one of the things that the Pershing County hospital community needs is an assessment, a needs assessment. We already have a 2023 counties report card that comes out of the Larson Institute and in association with UNR. And Larson Institute is basically the School of Public Health in Reno. And they have provided that information. There's a 2023 outline. I believe the county commissioners received that, a briefing on that from gentlemen Gerald Ackerman and John Packham, who are involved in putting that together. We're with the new state health assessment. The Nevada Division of Public and Behavioral Health is starting what's called a SHIP process. So State Health Improvement Plan, and they're just starting this. From the things that they have evaluated, there are 4 areas that they're going to focus on is social determinants of health, access to health care, public health infrastructure, and mental health substance use. And from that, that'll break out into other categories that they will address. In the future, if you wish them to come to this meeting and discuss their process and what they've found so far, I'll be happy to present that to you. The health assessment, the 3 big positive findings that they found for us is there's a low prevalence of excessive drinking, a low occupational fatality rate, and low residential segregation. The big challenges that they've determined are there's a high prevalence of non-medical drug use, high rates of economic hardship, and one that touches us here in this community is poor access to care with an especially low rate of individuals having a primary care provider. I've been working with, at the behest of the county commissioners early on, working with Banner Health, Renown, the University of Nevada School of Medicine, and community here about trying to start a residency program in Churchill County, a rural family practice, and have made good progress in that everybody's come together and can find a route of agreement. And with the current legislative climate, there is monies available to have grants to start this process. The problem that the roadblock we've come into is we don't have board-certified primary care providers that are available to do the residency program. And there has been some shuffling recently where the Nevada Health, Sierra Nevada Hospital has decided to leave this community. And so the primary care providers under their hire have been given notification that they're no longer are going to have their practice here, and a general surgeon is probably going to be leaving and going to Reno to work there. This is all just in the process. It's not fact. I'm just giving you kind of the outline of what I've heard through the involved people. So this group that's trying to get a residency practice here is blocked because we don't have primary care. We just don't have the people to really run the program. Also, there are recruiting process things that we look at. It's, bringing people to Fallon, and there's been a lot of things that have been done in the past. As when I was first interested in going to school, Churchill County would have a scholarship for people that were going to Reno, and they would offer them a stipend during the time, and just like the military, they would be required to come back to Fallon and spend a certain amount of time here working. So with that said, that's kind of the little crises that we have going on here. But in general, the health district is, we have the tools that we need to move ahead. We've had a great opportunity to meet with the counties, and we'll keep going out and talking and finding where our niche is in each county. And it's going to be different. It's going to look different in every county. We're not going to be all clinical in one county. We're going to maybe do more social services almost. We're always going to do inspection, environmental, epidemiology, but we will try to put ourselves into the position where we're filling a need, not competing with any of our counties. And sorry for the long discussion, and I appreciate that. Is there any questions for me at all?
Let's go back to physician recruitment. As you know, I've been doing that since like 81 or something, I think, when I started on the hospital board. But I wonder if each of the members of, this board, maybe this needs to be a focus of ours. We've never had Central Nevada Health District before, so maybe that needs to be a focus of ours. Some kind of coordination, and I meant to talk to Darren about it the other day. And we utilize the members on this board through Central Nevada Health District to go back to those elected members in their communities and talk about what can be done for physician recruitment in these rural areas, primarily these 4 counties that were really drawn upon now to try to improve healthcare. And I remember that program, and maybe those funds have to be from us, this program you're talking about, the residency program, and from the city and the county in those counties that we're involved with, to try to bring doctors to each of their communities, whether it be in Mineral County or Lovelock. And, Mineral County has 1 board, but Lovelock has 2, and we have 2 here. And I think Eureka has 1, but and they have to put up money to match or help what we do. And then we make this zealous effort. And then I've always been for that program where you send someone out of your high school to med school and they come back here. I've always been a supporter of that program, and you pay for them to go to school. And then their likelihood of staying is much higher, you know. And I don't know if that role is just the city and the county to talk about doing that, or whether Central Nevada Health District should play a stronger role in that now that we're viable. But something has to be done differently in the rurals than what we're doing. Because, as you know, we just keep recycling, or not even recycling, we just keep losing physicians. They come and go. They don't come back usually. But and these people out here that we serve need physicians. They need nurses, and healthcare people who follow those magnets. So I wonder if this board needs to take a stronger look at helping these local governments who don't have healthcare people on their staffs. That's not what we do. But we do here. And then work with the Lovelock Hospital and Mount Grant and whatever, to try to help and Banner to try to help facilitate physicians, and for heaven's sakes, renowned urgent care down here that some days doesn't have anybody there and some days does. And you're trying to serve Fernley too, so for the people that come into Fallon. But I think we need to play a role in that, and I think today isn't the day to discuss it. But I think we need to, as board members, we need to think strongly about that. Whether is that something we want to do or not, and then if we decide we want to do it, then we need to really start trying to put these people together, in not as a region, but in their individual communities. Our staff with Lovelock, our staff with Fallon, our staff with Eureka, and our staff with Monroe County and Hawthorne, to try to set up some program. And if someone doesn't want to buy in, then that county is just not in it. But maybe two are. To try to recruit physicians to, there has to be people who are not happy in a big metropolitan area, and we're not reaching them. And we know that there's regular citizens that are moving to our rural area. I mean, people like us that are moving to a rural lifestyle. Well, there has to be people in all walks of life that are moving to the rural lifestyle. And a lot of them are on contract now. So I don't know. I know Dr. Heath would know a lot more than I would know. But and I know a lot of it is about the government and the federal government and how they pay these people. But when they're out there doing a lot of paperwork for nothing. So I think the board, though, should have think about it. Think if that's something is that something we consider health? Central Nevada Health District. Trying to pursue physicians with those local governments who should be our partners in that, not us trying to go out there and do that alone. I think you touched on something that I think is really important. So I leave that just at that today for you to all to think about. And in the next few months, I think that's something Darren ought to probably talk to different board members about and see whether that's an avenue we want to pursue. It's nothing new. And I know a lot of people have done different things. I have a question on the clinical services quarterly review. You have immunization, you have in Fallon Lovelock Mineral and on your clinic visits, and you have immunizations and family planning and STI testing and treatment, and you have TB testing. And on the TB testing, you have 30, 33, and 23 in December, January, and February. And in Lovelock and Mineral County, for the same dates, you have 0. And it just struck me as odd that you have 86 in Fallon in those 3 months, and you have 0 in the Lovelock and Mineral in those 3 months. Can you explain to me why
Yes.
nobody in Lovelock and Mineral County wanted to get tested for TB, and almost 90 wanted to get tested in Fallon? Is there a TB thing in Fallon and people are worried about, or is someone pushes TB tested in Fallon more than in Lovelock and Mineral, or?
Good observation. Ted McDonald for the record. The reason is we do TB testing for New Frontier. And every time they have a new resident that comes in, they're required to have TB testing. So every Tuesday, we're available to do their TB testing, and we do receive grant funding to do that. So that's the only reason why. There's really,
For the board, I guess you should tell them what New Frontier is.
New Frontier Treatment Center. And initially, right now, they have in-house services for drug and alcohol rehabilitation. They also have health services for mental health, behavioral health, and also for people that could come in and talk about family issues. So they're a full-service area, and they have been in place for over 30 years. And this is just part of something that they have done in the past. Initially, the state did the testing for them and did tine testing, which is the little injections under the skin. Now we do blood draw for them, and that's part of the reason why we're coming to you also with those contracts, is we are doing more blood draws and need to have the resources available. It is a screening process that's set up because just based on they're going into a living situation where they're going to be in with 30 or 40 people over a period of 3 to 6 months, and also some of their history may indicate that they may be at risk for TB. Other TB screenings are based on, when somebody develops a chronic cough, or they're referred by their primary care. So that doesn't really happen very much. The last year in the state of Nevada, they had 4 cases of TB, mostly in the southern region and some in the northern region. There is some thought that across the United States that there is maybe more of a need for doing testing and screening before, but we, at this point, this is just a one-off thing where we're doing it for the facility.
Okay, thank you.
You're welcome.
That's all the questions I have. Anybody have any more questions? Okay, thank you. We'll go to item 10, was for...
Mr. Chairman,
Oh,
may I
yes.
interrupt real quick?
Sure.
Just a quick update. Dr. McDonald touched on some of the epidemiological efforts that are underway, and I'd like to introduce Victoria Sepsic. She is our epidemiologist. We were fortunate enough to be able to steal her from the state. A lot
Nice.
of background behind her, and so she is busy creating that program. We have a disease investigator on board as well. And so I think now we're pretty much taking on all the cases from the state, and she's going to get pretty busy. So I just wanted to make sure you know about Victoria and introduce her, and a great asset to us.
Nice to make a good steal. Welcome.
Yeah, we have, yeah. And
Okay,
just
go
a really
ahead.
quick update. We are moving fast and furious. The month of April for us is going to be crazy. We are doing a lot of events. We have the Wellness Expo in Hawthorne, working some outreach here in Fallon, doing some Parents Night Out in Lovelock. So just finally, I think, we put all these pieces together. Now we're finally hitting the ground running. Just a lot of things going on, a lot of outreach happening. And so it's exciting to be out in the communities. And we're looking at trying to do some meet and greet with Maria's program and the environmental health side. We're going to start probably here in the city of Fallon to kind of meet your inspectors and understand what that means for people in the food facility realm, and get to know everybody and know that we are partners in that endeavor. So, I just wanted to give you an update. Just lots going on coming up, starting in April and all the way to the foreseeable future. So, thank you.
Do you have a time frame of when you move into your new building?
Unfortunately, no. I talked to Ms. Ernst about that today. No new updates. So,
Okay. I'm giving you more time to tell me you have something else. You're good? Okay. Now we'll go to public comment. Is there any public comment, general in nature, not relative to anything on the agenda today? Discussion can be held, but no decision can be made. Being none, we'll go to item 11. Nothing more for today, so we stand adjourned. Thank you all for coming.
Thank you.